Thank you so much for sitting in on our breakout session. I'm Jessica Lopez. I'm an attorney at Circle Surrogacy, and with me today is Jenny Denhoff, who's actually a former surrogate through Circle Surrogacy, who loved what she did so much. She actually came and became a program manager for us. So we're here to talk to you a little bit about what makes Circle Surrogacy a great agency to work with. We are founded by a gay couple who are actually parents through surrogacy, and their kids are actually now in college. So they've had many years of experience with the process themselves personally, and also catering to different parents here domestically and also internationally. We've worked with a variety of families, so we know the types of things that you're looking for, the types of questions that you might have. And we consider everything as far as the legalities, the emotional aspect of a surrogacy. You're investing a lot of time and emotion into this process. So having personnel who has been through the process helps us navigate it very successfully from an intended parent's perspective. Now, we also are a full service agency, which means that we have different departments that are going to help you through every facet of the process, with the exception of the IVF clinic. So we have a full staff law firm. We have attorneys that are going to be representing you and establishing your parental rights through contracts with the egg donor and the surrogate, wills to basically address any sort of unforeseen circumstances that might happen, and also legal parentage in the delivery state or in your home state as well, if necessary. Also internationally, if there's any sort of dual citizenship and parents want to make sure that their child can also obtain that citizenship, we can help with that aspect as well. We've established pretty good relationships with different attorneys throughout the world that can help us ensure that we are sending parents back home safely to their countries, or that they have the necessary documents to obtain citizenship in that country. We also have a whole accounting department, so they're going to be handling all of the logistics for you financially, so you don't have to worry about those details every day as the different bills and costs come up. We also have a social work team that's going to be there to help you process everything that's happening. There are ups and downs that you're going to be facing, and we have a whole team there that's ready to walk you through it, guide you through some of these unforeseen circumstances that might come up. And then we have the program coordinator team. So they are going to handle all of the smaller, minor details for you. So you don't have to worry about the logistics as far as dates, scheduling things, making sure that this is in place, that that's in place, etc. And we also have some gestational surrogates who were carriers for our clients who have now returned to work for us as well. So it's very helpful to have that point of view as well as input. It's helpful to also be able to help foster a relationship with you and your gestational carrier. You want to have a successful relationship where you can speak with one another, you're open about how the pregnancy is going, how she's feeling, how you're going to be when the delivery happens, and you're in the delivery room, or what it's going to be like after the fact. And lastly, Circle does also offer a lot of different ways to control the costs that are associated with this. This also includes things like unlimited matching, unlimited transfers, and we also have sort of plans that are fixed fees that lets you minimize the uncertainty as far as the financial logistics of what this is going to involve for you.
Yeah. It's like Jessica said, I was a surrogate and carried twins for a gay couple from New York, and just became very passionate about what I was able to do, the gift I was able to give, and decided this needs to be my career. This is where I'm at. So started working for Circle and have now become a program manager, which allows me to continue on doing what I love, what I'm about, with intended parents, surrogates, and donors, carrying you through basically your entire journey. So I tell you this just to let you know that I've kind of been in your shoes, and that I had all this information in my head and agency after agency after agency that I could be working with. I was overwhelmed and stressed at times and excited at other times, so I can appreciate where you're at. And I know one of the things that I was looking at is, I know I want to do this, but what's next? What do I do now? So if you're thinking that, here's my take on that. If you're going to go with Circle, what's next is you sign on for a free consultation. And with that, you're going to hop on a Skype call with somebody like Jessica, an attorney with Circle, and somebody like me, somebody who can say, here's what the process is going to look like for your case specifically. We'll go through the agreement that you would have with Circle, and then we'll answer questions that are specific to your case, so that we can get an idea of what you're looking for and let you know how we would address those needs. Once you sign on, after you have the consultation, you'll sign on with us, and you're going to get introduced to someone like me, your manager, who's going to be there from that time all the way until the time that baby or babies have been born. And I introduce you to your coordinator, who's going to handle all those logistical things that Jessica's talking about. We're making sure that surrogates getting paid, donors got insurance coverage, and that we're communicating with the clinics, we're arranging travel, all of those things. So we're coordinating that piece. I'd also be introducing you to the lawyer who's going to take you through every step of the process, legally speaking, and an accountant liaison who's going to manage the funds throughout. So you've got this small team, this small group of people within a very large agency who knows your case inside and out and is there to kind of walk you through the whole process. It's a complicated process. I like to think that as an agency, we're the hub. You know, there are all these pieces going on. We help to arrange them all. And I guess one of the things that I know I was thinking about is I just wanted somebody who has been through this process before, somebody who really knew what they were doing. And that was what drew me to Circle. Was I looked and I thought, they've done this. We've done this over and over and over again, and we have over 1,000 babies to show it. So at any rate, you're in good hands with Circle, and we hope to have the opportunity to get to work with you and follow you through your journey.
You can open it up to any questions you might have.
Do you work with any IVF clinics in particular?
There are a couple that we work with most frequently. That being said, we've worked with probably every IVF clinic throughout the country. Some parents like clinics that are closer to them. Some choose a surrogate and then choose an IVF clinic, but we're certainly open to working with anybody.
If you're the type of person that says, just tell me who I should work with, then I'll have success, we can do that. And if you're the type of person that says, this is the one we love, we'll work with them.
Anything else?
Do you handle situations where the IPs already have donors and their surrogate already lined up?
Yes, some people do come to us like that, and essentially they're asking for coordination. You know, handle all of the logistics as far as the legalities, the contracts to be in place, coordinating with the IVF clinic, making sure that everybody's, you know, taking their medications, the cycles are scheduled, that appointments are being scheduled. We're making sure that the pregnancy is going along very well. She's getting her payments. You're being updated, or you're participating in the ultrasounds. Handling the legal work as we get closer to the delivery to the delivery time, and then just discussing any sort of post-birth steps that you have questions about as well. And one of those steps would be to liaise with the hospital as well, prepare them for the delivery, inform them who's actually there for the delivery, who can be in the delivery room, who has access to the nursery room. Will the fathers have a room to stay in the hospital overnight so they can be close to the baby, details like that. So yes, we can help with that too.
And there's screening because they're both in different states.
Mm-hmm. Did you say screening?
Screening.
Mm-hmm.
Right.
So we would screen them as well to make sure that psychologically and also health-wise that they would be able to move forward with the process. Your IVF physician too would want to review their medical records to make sure that they're going to respond well to the medications and actually be able to carry a pregnancy for you.
Sometimes it's nice to have that third party involved that's
Right.
take care of all the uncomfortable things. Anything else you guys can?
So we actually have a sign-up sheet downstairs too. If anybody has any sort of questions, or you might want to obtain a little more information about Circle, we can give you some documents, or you can sign our list so we can send you any specific details that you're looking for as far as costs, or details about the clinics that we work with, or the agency itself.
What are your average costs?
So it depends on your exact needs. What we are looking for as far as domestic parents here in the United States with their own insurance who need an egg donor and a surrogate, The estimated costs are around $90,000, I believe. Now, we will always tell you to plan for about 10 to 20% higher because there's a lot of contingencies that can happen. Minor details such as the travel to the IVF clinic. You know, if your clinic is in California and your carrier's in Massachusetts, you're going to have to accommodate travel for more than just a same-day trip. So that's why we also just mentioned plan a little bit more. The IVF clinic expenses are also separate because we don't specifically have a clinic, but we can also manage those funds in the escrow account for you if you'd like us to do so.
International?
Yes, we work with many international parents. Where are you from?
Dominican Republic.
Oh, okay. We work with a lot of Central American, South American, Caribbean clients. We actually have Spanish-speaking staff members. We also have surrogates who speak Spanish that we could match you with, so it's easier to communicate with them and feel more comfortable throughout the process. But yes, we work with a lot of international countries.
And I learned Spanish if you sign on.
I don't know how we are on time.
Yep, I don't know either.
Well, like I said, our booth is downstairs. If you'd like to stop by and just chat a little bit more or put down your name for some more information, we're happy to speak with you.
Thank you so much.
Thank you so much.